Good morning, everybody. I will present you a clinical case. A real case we met in our clinic is not a fiction. And I want to share with you the journey of the patient. She is a 18-year-old patient. He flees from war together with her pregnant mother and her 10-year-old sister, and they arrived in Berlin. But the safety doesn't come easily. And shortly after arriving in Berlin, she became ill with fever, abdominal pain, and fatigue. At the hospital, ultrasound shows ovarian tumor, and the doctor said maybe you have ovarian cancer. But
Jalit, dear moderators, you're making me humble, and I thank you very much for the opportunity to talk in front of a distinguished audience from a completely or distant field at least. And it's a pleasure to give you some insights into what neurosurgery can do today and what metastatic brain surgery means. In fact, it has become not only a part of neuro-oncology, but at least in our department, it's really a focus area for both clinical and experimental research, and I'm very happy to share some insights. So these are the entities that prefer to metastasize also to the brain, and you can see that breast carcinoma is a runner-up, but there are also other gynecological cancers that have been described to metastasize to the brain, as you have just seen in the case report. And now I understand why the image generation for AI is suffering currently so much, since you're making all these slides from with AI. But it's really becoming a part of our interdisciplinary work to treat these patients. And as you mentioned, it's always a bad sign if patients develop brain metastases.
This brilliant talk. I really hate to bring you guys all down from the digital brilliant future of the digital OR back to the harsh reality of the gynecological OR. I'm really envious about all these techniques, so it's really an amazing sight. I was asked to give a talk about oligometastasis in ovarian cancer, and I found that actually quite challenging because oligometastasis is not really something that we talk a lot about in ovarian cancer, right? These are my disclosures. Why don't we talk a lot about oligometastasis? Because in other fields, maybe colorectal cancer, this is a big thing. But this is because usually we're looking at something like this, right? In primary ovarian cancer, we're looking at diffuse peritoneal carcinomatosis, maybe a big omental cake. And even in recurrence, we usually face off with peritoneal carcinomatosis and not really a lot of metastatic sites. But if you look at this patient that I brought with me from the Charité department, it's a 61-year-old patient that presented first with high-grade serous